Welcome to the fifth videos of the series Studying and Learning Skills for Undergraduate Medical Education. My name is Mohamed Hassan Taha. I am a medical educationalist and I am the director of the Medical Education Center at the University of Sharia. In this video, we'll be talking about studying and learning skills for undergraduate medical education and students, and it will be two parts. The first part will focus basically about note-taking and reading strategies, and the second part will be basically about the skills, other skills, including time management and supporting and building resilience. Let us start. So this will be the first video related to study and study skills for medical students. As you can know and you can see, medical education is cognitively demanding by design because curricular is heavy and you have to study huge amount of information in a short period. And actually success depends less on intelligence and more on how you learn. Therefore, this session is designed to support you and to focus on how learning actually occurs, why common study habits fail, and will support you also with evidence-based strategies for reading and for note-taking. So, why this session is important for you as a medical student? Because medical curriculums are heavy contented, time compressed, and assessment driving, assessment all the time. And poor study strategies lead to surface learning and therefore forgetting and inability to apply knowledge clinically. And this is very important for you for your clinical practice. So study skills determine academic performance in the School of Medicine and Dental Medicine and Health Science. Also determine clinical reasonings development and long-term professional competencies in the near future. What are the outcomes of today's sessions? The outcomes of today's session is to explain effectively study skills are essential in medical education, apply effective take notes following the session, and explore active strategies to extract and evaluate key information from medical text. And finally, I want you to reflect on which strategies best support the learning process. So let us start with common ineffective habits in medical students by medical students. So some students, they are continuously rereading lecture slides repetitively. I mean by slide here the PowerPoint. And some of them, they highlight the entire paragraph. And they copy notes only, copy notes verbatims, and studying passively for long hours and avoiding self-testing. These behaviors actually, it gives some feel of productions. However, they produce a weak, some sort of weak learning. So in order to develop effective strategies, we need to think about effective strategies as a system approach. And high performance students use this as a system, not isolated technique. And this system included but not limited to purposeful reading, generative taking notes, question-based review, retrieval practice, and space revisions. And please go back to the second video of this series to watch the techniques related to space repetition. So each element of these 5 elements reinforce each other. This is very important to consider this element in this way. And therefore, taking notes, it is a cognitive skills. By any means, it is a skills, and it is a learning activity that requires selection of important information, organization of idea, transformations into your own words, and the goal here is understanding of the knowledge rather than completeness of this task of the study. So, what learning really is and what is not. So, learning is not about listening to videos, it's not about highlighting, it's not about copying the slides, summarizing. It's about active processing in which we interact with the learning material. And it is meaningful constructions we build on what we learned before, taking into consideration that the prior knowledge is well structured. And it needs repeated retrieval of the practice and of the information. And if learning feels effortless, it's usually ineffective. So we need to interact and to engage with this material. And we want to move from data to information to the knowledge, as you can see here. And what we mean by knowledge, to keep the information in a meaningful way. So for learning to occur, attention must be focused. And the next video will help us to build some habits that can support us to develop our focus as medical students in this distracting era. Learning occurs for learning to occur also, new information must be connected with the prior knowledge, and this is very important. We have to do some sort of connection, and we need to organize the ideas meaningfully, as you can see here in this screen. This is very important and issue that we need to take into the consideration. Yeah, and it must be retrieved. It must be retrieved repeatedly, and study skills exist to support this process. So it's very important to apply the skills to support this process. We want to understand the cognitive load in medical education and medical learning before moving to the taking of the notes. And we have to know that we have different type of memory: very short memory, and long-term memory. And actually, the working memory, which the second stage after the very short memory, it is very limited, and the medical context definitely is complex and dense. And poor study habits overload our brain. This is a fact. And effective study skills, it reduce the unnecessarily load, and it will free our mental capacity for better understanding, and therefore it improve the transfer to the clinical context in our curriculum. To understand this clear, let us explore the cognitive load and the cognitive load theories, and the next two slides will explain this to us to be very clear and to rationalize the way of taking notes smartly. We have three parts of the loads. The intrinsic load, the extraneous load, and the German cognitive load. The intrinsic cognitive load, as you can see in the screen, it is related to the subject matter and the complexity of the information or of the new information. And as a learner, we have to make sure that to simplify this. And this is related to the nature of the subject matters, and this need to be very simplified. And there are some materials by design, they are very complex, and I will give you example in the next slide. For the extraneous load, it distracts the working memory from processing new information, and this may be new to start reading the materials not organized or heavy text and so on. And this is very important thing that we need to work on. And the German load, it is related to deepening processing of new information by integrating into previous learning, and this actually need effort from our side. So in a simple terms, or in a simple action items, for the intrinsic load, we have to simplify. For the extraneous cognitive load, we have to reduce. And for the German cognitive load, we have to boost. To make this clear, let's see this slide. So what it means for you for the intrinsic load, it is related to the difficulty of the topic itself. For example, understanding renal physiology before acid-base balance interpretation. And this is very difficult. We need to, for example, if we want to understand a complex task, we need to understand, for example, the basic science, to integrate the basic science with clinical science and so on. This is very important. And comes from complex medical content. You cannot remove it, but you can manage it. This is very important. And how it feels, you feel from the beginning this topic is very hard. And what you can do, you have to revise basic first and then learn it in a small chunk. This is very important. What about for the extraneous load? Extraneous load, how clear or confusion the teaching material. And sometimes for us, from our side as educators, we teach you heavy slides and so on. Or long lecture with crowded slides and no clear instruction. And it comes from poor presentation or distraction, and you should try to reduce it. How it feels, this confusion, you feel this confusing to me. And what you can do is study in a quiet place and use a clearer resource. You have to be very smart and choose a clear resource. Then, for the Garmin load, what it means to you, it is the effort to invest to true understand. It's not a difficult thing, but you need effort. For example, solving equations, solving acid-base problems using renal case, analyzing. And it comes from active thinking and practice. And you should aim to increase this. This is very important thing that you have to consider. And you feel it in now, I understand. Yes, I understand, but I need to do some effort. And what you can do, you have to practice the concept and explain the concept aloud and seek always feedback from the instructor. After understanding this load, we need to go to the next step is study skills. And one of the most important study skills that I highly recommend you to sharpening your skills in is the taking note. I will start with taking note, and this session basically will focus on the Cornell note, taking note strategy. So why note taking matter? Because it helps us to retain more information and to organize the complex topics. And this is closely linked to our discussion previously, just a minute ago, about the cognitive load. And active learning, it will help us to move to active learning instead of passive learning. And one of the most common taking note strategy is the Cornell note. And as you can see here in the right side of the screen, in the Cornell note, we bring a paper and we divide it into 3 sections: the Q column, the note column, and the summary column. So in the left margin, we put the key words and the questions. And in the right margin, we put the lecture notes. In the bottom, we put the summary. Let's do it step by step. We have to prepare a paper with section, take concise notes, add cues and questions, and summarize the point. How to take the notes? We have to prepare the note, and after doing this, preparing this and doing the different 3 sections, we can make 2 inches from bottom, then from here, a vertical line down the left, the paper, and leave the largest part on the right side. And this because we will be taking the note here. We have to mark the lecture name or the chapter name or the course name here in this way. Then we can start taking the notes. whenever while you feel there is a very important thing that you can take it. Then you can review and expand the notes. Try to keep it simple like this. Don't keep it crowded. Keep it simple like this. Then we have to write the potential questions and summarize the key in the left side here, as you can see in the screen. You have to read the notes and to concentrate on the left, because the left is for the questions and for the cue. Then when you read the note, you can just, as you can see here in the screen, you can just cover what you have taken as a notes and read the questions, and then you can do the recording. This is very important. So you have to read the notes, you have to concentrate on the left column and the summary and the summary in the bottom of the note. You can use your recording note to study in this way, and you can make it like a circle, read the questions, and then cover the notes, read the right side, and then try to get the answer in the right side and in the bottom. So this is one of the most important strategies that you can follow while studying medical education. The other important strategy that we will discuss in this lecture and in this video is the reading strategies. So why it is very important to know and to learn about reading strategies in medical education. Medical reading is different from general reading and from the other subject, because the information here is dense. We have some concept heavy, and we want to abstract some informations, and you are frequently assessed throughout your medical study. So this requires strategy. Let us define the reading. Reading is the process of constructing meaningful or meaning from written language, usually the interaction of decoding, compression, and the critical evaluation. So decoding the symbol into language, comprehend and interpret informations, and critically evaluate the strengths, the accuracy of the heavy text. So it integrates new knowledge and prior understanding to support the reasoning, problem solving, and decision making skills. This is very important. And it actually means decoding the information, constructing the meaning, evaluating the importance of this information, and integration the prior knowledge. So it is active strategy that we should follow while reading. So we should not consider eye moving across the text is the reading. So this is not a reading by any means. And so this is very important. Without having effective strategies, we will end up with overload, poor retention, and wasting the time. And with the strategy, we'll end with the focus, efficient, and meaningful learning. And this will lead us to purpose-driven reading. And before you read, we have to define the purpose of the reading, understand the concept, prepare for the exam, apply knowledge clinically in the future, and evaluating the evidence. And purpose determine the strategies. And always we should establish relevance with what we read with your practice. And one of the most common strategies that will be discussed today is SQ3R strategy. And to understand this strategy, we need first to discuss together the different types of reading skills. One of the types is the skimming, or you have to go through the general ideas. Then scanning for finding specific information, then extensive reading by broadening the understanding, and then intensive reading in which we should be deep and we should be focused. In the rest of this video, we will discuss the pre-reading strategies and the strategies while we read and post-reading strategies. So before we read, we should define the purpose. Why am I reading this? How this can help me to advance my career? Is it related to practice? I have to activate my prior knowledge. If I'm reading this topic, which is, for example, about renal failure, I have to activate my prior knowledge about renal failure. I have to review the headings and figures and the summaries. This is very important in the text. And then predict any idea. So this is a pre-reading strategies. During reading strategies, for the active reading, I have to highlight and or underline the keyword. Take margin notes. You can follow the previous strategy, the corner notes. Ask questions while reading, and this could be by changing the headings into question, making connections to the lecture notes. And this actually is considered as part of the critical reading, in which I should judge the reliability of the source, evaluate arguments or evidence, particularly while when reading research, identifying any author's perspective or bias, or applying the findings in the context. And this is specific slide specifically related to research. What should I do post-reading? I should summarize the key points, review and reflect, discuss with my peer, and apply knowledge in practice or use a case study. There are several tools that I can use to support my reading, such as the note-taking templates, and we explained it before, coordinate notes, concept map, and you can watch the third video in this series about the concept map, and also the digital tool. Nowadays, there are several digital tools and platforms that I can use for this. SQ3R is one of the most common tool that I can use as active reading strategies. S for survey or scanning the text and pay attention to the layout, the chapter outline, sections, graphs, figures, pictures, and so on. Then I will ask questions and ask myself questions about the text, and ask myself questions that I already know about the text and the goal. And here I can convert the headings and subheading into questions. Then the other three part, the 3R, is the first R for read, then for recite, and then for review. For read, I have to read the text actively while keeping the previous step in the back of my mind. Write down any additional question. For the recite, this is related to repeat aloud using my own words and ask myself questions about the text, and I can explain it to another one. For review, it is related to read all relevant part again and go through the notes and the question again and pay attention to the parts that I feel it's difficult. So it's very important to consider this sequential survey, question, read, recite, and review. It is in 3 phases, but it is 5-step approach. Also, we can use the concept map, and we explain the concept map in the 3rd video of this series. Also, very active strategy. So far, we discussed the concept related to study skills, the cognitive load, how to manage the 3 parts of the cognitive load, the note-taking skills. We talk about the coordinate notes and the active, and we define reading and active reading strategies, and we talk about the SQ3R. There are other strategies that we can use for the study, including the mnemonics, in which it is a memory technique that help us to recall information, and it acts actually as hook for difficult or less sequence. But the issue with these techniques, the mnemonics, it creates superficial learning. We should not use it unless we have a better understanding, so as aid, not as a main tool. And it is very useful for exams and for memories. We can use it to reduce the cognitive load, particularly for the intrinsic load. It can improve the recall speed, post-exam performance, and make learning engagement. And the next slide provides us with example of this. For example, A, B, C, D, E, F, G, H, I. If I'd like to memorize the steps of managing a patient or doing emergency trauma assessment. A for airway, B for breathing, C for circulation, D for disability, E for examining the patient, F for the temperature for Fahrenheit, G for get the vital signs measured, and H for head to assessment, and I for intervention. The take-home message here from this video: studying is a skills, not a talent. Active learning outperform passive habit. Retrieval drive long-term retention. Reading and note-taking must be integrated with each other, and learning how to learn early is very important. Thank you so much for watching these videos, and I invite you to attend the next video, the sixth video in this series, which is the continuation for the study skills, but it will discuss a very important concepts related to how we can manage our time effectively and how we can build our resilience as students and study effectively in medical school. Thank you so much for watching these videos, and see you in the next video.